Hi, and welcome back. Today's video is more specifically for all the ladies out there. One question that I get pretty frequently is regarding mammograms. I'm often asked if there are signs of dense breast tissue on the mammogram. Does that mean that you have breast cancer? And the answer for that is no. Dense breast tissue does not automatically mean breast cancer. Okay, but having dense breasts does increase your risk of breast cancer. And it also makes it where when you have your mammogram, it can be more difficult to actually see a breast cancer. Okay, so if you are noted to have dense breast tissue when you get your mammogram report back, that does not mean that you have cancer, but that does mean that you want to have a conversation with your doctor about whether you should have an ultrasound or an MRI to get additional pictures of your breast tissue. When you talk with your doctor, they'll look at your age, your family history, other health risk factors that you may have, or lifestyle risk factors that you may have, and help you decide about additional imaging that might be needed if you are noted to have dense breast tissue. I recently had my mammogram, and so I make sure that I am staying up to date on my screenings, just as I'm encouraging each and every woman out there to make sure that you are staying up to date on yours. Mammograms should begin at age 40, but if you have a family history of breast cancer, then you will want to talk with your doctor about at what age you should begin. They will look at your family history and help to determine when you should begin having screenings. Okay. And it's important that you're having those screenings before there are any symptoms that set in, because if you have symptoms or changes in your breast tissue, then that means that it's no longer a screening issue that we're dealing with. It is now a diagnostic. Okay. And so when we do a screening, it is before symptoms, so that if there's some early changes that are going on, we are detecting those early. If you already are feeling a breast nodule or changes, then that is more a diagnostic, because there's an issue that needs to be addressed. And we want to do that as a screening so that we can detect things as early as possible. I was found to have dense tissue on my mammogram, so I'll be talking with my gynecologist about what additional screenings, if necessary, I need to have at this point. We didn't find any reason to do it sooner on the previous ones, but you want to continue to have those discussions because things may change. And so you want to continue having those discussions about, for this year, what does that mean and what do I need to do based off of my risk factors? And please keep in mind, the majority of breast cancers that are diagnosed in women who do not have a family history of breast cancer. So please don't have a false sense of security that you're going to be fine because there's no one in your family with breast cancer. Okay? There's always that first person that it happens to. Okay. The majority of breast cancer diagnoses are in women who do not have a family history. Having a family history does increase your risk. However, the most of those cases that are diagnosed are in women who don't have a family history. So please make sure that you're talking with your doctor about screening and getting those things done on a routine basis so that we can detect things early to help minimize treatments and actually help to prolong your life. We want you here to enjoy the fruits of your labor as you get older and all the work that you put into things that you're doing when you were younger. And so we want to make sure that we are detecting things early so that you can enjoy and do those things that you want to do later in life as well. So I hope that this information is helpful. Click the like button, share it with another lady in your life who might need to hear this message. And I hope you have a wonderful day.